Every year, about 287,000 mothers and 2 million children die due to preventable complications of pregnancy and childbirth. These are not just numbers. They are our daughters, our spouses, our mothers, and family members. Almost 95% of these deaths occur in Sub-Saharan Africa. And for many, the cause is the same: excessive bleeding after childbirth, known as postpartum hemorrhage.
We could refer mothers due to PPH. By the time you reach Nakawa, the jam, and all that confusion on the way up to Kawempe, you reach when the woman has died on the way. Or by the time you reach Kawempe, they can't save the mother.
That time, it was really tragic. We could feel bad. We could feel torn in two pieces as a midwife to see a mother dying. We could feel we needed someone to empower us. We needed something to use to make sure that we save life.
In 2023, Save the Mothers donated 25 anti-shock garments to 6 hospitals in Uganda under its Mother-Baby Friendly Hospital initiative. The Non-Pneumatic Anti-Shock Garment is a low-technology, first-aid medical device designed to stabilize women suffering from postpartum hemorrhage, PPH, and hypovolemic shock. It works by applying external pressure to the abdomen and lower body, which redirects blood to vital organs, and buys precious time for women to reach definitive medical care. The hospitals that benefited from this drive include Kawolo Hospital, St. Francis Nagalama Hospital, Mukono General Hospital, St. Francis Nyenga Hospital, Mukono Church of Uganda Hospital, and Buvuma Health Center 4. Case in point, the district of Buvuma is a hard-to-reach fishing community with Buvuma Health Center 4, among the 12 health facilities serving over 52 islands in the area. The anti-shock garments have been a lifeline to the women in these islands. A team from Save the Mothers traveled to some of these hospitals and communities to speak to health workers and mothers about the benefits of the anti-shock garments. Sister Rose, a midwife at Buvuma Health Center 4, shared with Save the Mothers the profound importance of the anti-shock garment in saving mothers while crossing the turbulent waters around Buvuma Island.
If the turbulence on the lake is very bad, you find that you may be blown by the wind, maybe to a different place that is not your destination, but you are here with your NASG well applied on the mother. You are trying to save a life as you keep other measures in place like rehydration and drug administration.
Winnie and Luca lost their newborn due to pregnancy-related complications, but because of the anti-shock garment, Winnie's life was saved. Their testimony shows how helpful the anti-shock garment has been to the women in the hard-to-reach areas of Buvuma Island.
When I got off the motorbike, I started bleeding profusely.
We had a stillbirth. We gave birth to our baby, but it was dead. When she was taken, she did not have any coverings on her. They tied her up from the legs, here and here, at the waist and also at the breast area. I think when they tied her up, her life was preserved. This, I believe, kept her safe. The tool used was blue in color with some black on it, with numbers 1, 2, 3 and 4. In Bujuta B, Nyenga, Buyikwake district, Save the Mothers met Fazira, a mother of 2, who due to PPH was referred to Kawolo Hospital, and because of the availability of the anti-shock garment, her life was saved.
The bleeding was too much, and she asked me what happened. We went back. She checked me but failed to know what the issue was.
On arrival, we quickly helped her and we quickly applied the anti-shock garment. We maintained the anti-shock garment for the 8 hours, but during that we could keep on checking the observation, the blood pressure, the pulse. Not until when her pulse was stable, that's when we took off the anti-shock garment.
Sister Rose, who has used the anti-shock garment to save many mothers, speaks about one case that stands out for her in a hard-to-reach community of Buvuma district.
After monitoring our labor very well, time for delivery came. We gave birth to our baby, but immediately we removed the placenta. The mother started bleeding profusely. She bled. We tried interventions that would stop the bleeding. We tried looking for the cause of the bleeding. We could not ascertain because the uterus was well contracted. There was no tear. But at the end of it all, we had our anti-shock garment at hand that we had to apply, the NASG, that helped us apply pressure on the lower extremities of these mothers. We had to compress these legs to push blood back to the heart and other vital centers to ensure that we save the mother. When we tried running an HB to estimate the blood levels of this mother, can you imagine it was just 2? And on reaching the regional referral, everyone was amazed by the way we were able to move with a mother of an HB of 2 from the island that takes about 1 hour on water with a speed ambulance to the mainland that takes us about 30 minutes. That is 1.5 hours from the main water to the main regional referral.
At St. Francis Hospital, Nagalama, Dr. Simon narrates yet another inspirational story in which the anti-shock garment enabled his team to save a mother with an ectopic pregnancy.
A pregnant woman who had an ectopic pregnancy, which was initially misdiagnosed to be ulcers because of the abdominal pain. So we applied the anti-shock garment to stabilize the woman, did our CPR, and she was stabilized. We were able to get back her vitals. We got IV access and put in blood and also other fluids. 12 hours later, we were able to remove the anti-shock garment when the woman was in good condition.
Since 2023, in Kawolo, we haven't registered any maternal death due to PPH, just because of the anti-shock garment.
On a follow-up assignment, a team from Save the Mothers took the initiative to visit some of the facilities that received the anti-shock garments. While at it, they found out some of the challenges the health workers are facing in the usage of the anti-shock garment.
They are reusable and they lose elasticity, so they cannot keep reusing.
We've really found it hard to disinfect it in preparation for the next patient. However, we prefer to use soap and water, but since it is soaked in water, it takes a long time to dry. And the good thing with us, we received 4. By the time one is drying, it can take like 2 to 3 days, but at least we still have 3 in custody. Then the other challenge is the size. The size is constant. I think we received medium, but not all mothers are of equal size. So we really find it hard when you get a very big patient. It may not be applicable because of her size.
We're really very thankful to Save the Mothers for extending this equipment to the end users who eventually apply it to the patients, and we try to save lives.
The people and organizations, my message is, if possible, give us more.
I thank the Save the Mothers organization. The plastic equipment they brought helped to save my wife.
I'm alive. I'm alive. I'm alive.